Assalamu alaikum. So, students, uh, I hope all of you would be all right. So, we were studying about joints, and we're going to continue that. We're going to study the joints further. And remember, this is kind of an overview because some of you might already have studied these subjects. So, it is especially for the newcomers, and this time we are going into more detail because we've studied so many systems, and by now you must know some terminology that goes behind the scene as well as some other things, so you may be able to better understand this thing now. So let's start the synovial joint. So the synovial joint is a joint in which two bones are separated by a space that is called a joint cavity. Cavity is a space that is located anywhere in the body. That space would be known as cavity, such as the abdominal cavity contains the abdominal organs, such as the thoracic cavity contains the lungs, etc. So this cavity would contain some fluid, some other things, some structures that would be helpful in the movement of joint as well as decreasing the resistance that is present between the two bones while movement. So they effectively inhibit the friction that may be present between the two bones. They do not let the bones touch each other. Moreover, they would provide cushioning to the bones. As all of us know, bones are very vascular organs. They have rich blood supply as well as rich nerve supply. So, if the bones are touching together while moving, or they're showing resistance or rubbing against each other, there would be immense pain, unbearable pain in the bone. If any one of you have ever like gone through a fracture of a bone, you must know the pain of a fracture is unbearable until unless it is secured into its place via some mechanism, via applying a plaster or something else. And the bone fragments are adjacent to each other up until the point where you stabilize a fracture. The person who has the fracture is in immense pain. It is unbearable pain. So to protect the bones from rubbing against each other, to protect the bones from damage, we use this mechanism that is known as the synovial joint. So, in addition to reducing the friction, it would also provide a cushioning. Uh, to understand what is cushioning, I'll give you a simple example. If you are made to sleep on a hard surface, such as on earth, let's suppose, or on tiles or on bricks, anything. When you wake up in the morning, you'll feel sore as if your uh, whole body is in pain. Or if you're falling from a height, if any object falls from a height and it hits a hard surface, it would that would have effects on that object. It would undergo some kind of damage. Same is the case with our bones. When we stand, if one bone directly hits the other bone, it would cause damage to both bones, to the ends of both bones. But cushioning is just like a cushion, such as when we sleep on the bed, we use mattress that is foam that keeps our body cushioned from the hard surface. Moreover, if a person falls on a mattress or kind of a flexible surface, he would not get hurt so much. So this is what the synovial joint is trying to do. So now let's look at the structures that are present in the synovial joint. So there is one proximal bone and one distal bone to the synovial joint. Proximal is that structure that is near to the mid or middle of the body, whereas distal is away from the middle. For example, our humerus or the upper arm, it is proximal as compared to the lower arm or hand. So that upper arm is near to the trunk, that is why it is proximal, and hand is distal because it is away from the trunk. So now let's look at synovial joint. Synovial joints are present in larger joints. Synovial joints are present between larger bones as well as the smaller ones, such as this is the carpometacarpal joint. No, this is between two metacarpals. Sorry. What can we see here? We can see a capsule kind of structure that surrounds this joint. So this capsule is made up of fibrous tissue. Okay, so this is made up of collagen fibers. These collagen fibers are very sturdy. They have so much strength as to resist breakage of this joint or leakage of the internal fluids or the internal structures, damage to the internal structures. It prevents that. So this is this white structure is the outer capsule, that is the fibrous capsule. Then comes a membrane, that is the synovial membrane. This reddish colored structure is the synovial membrane. Inside the membrane there is a fluid that is known as synovial fluid. This synovial fluid does all the work. It provides the cushioning, it provides the lubrication. Now to understand the concept of lubrication you must understand it by now, but to make it easier I'll give you an example. If you take up two pieces of iron or any solid substance and you start rubbing them against each other, it would require more force. But if you apply some grease or oil on those structures, the resistance decreases. Same is the principle that is happening here. So this synovial cavity would contain the synovial fluid that would provide the lubrication to these bones. Moreover, on the ends of both of these bones, because we want to prevent them from rubbing against each other, there is a cartilaginous membrane that is present. See this whitish thing, this is the cartilage. So all of us have eaten chicken, right? चिकन का अगर हम वो देखें, लेग पीस जब हम लेते हैं उसके कोने में वो हड्डी होती है कुरकुरी सी, ठीक है, the soft kind of tissue on the end of the chicken leg piece, that is the cartilage. So that cartilage would protect the inner structures of the bone from rubbing against each other. This cartilage is known as articular cartilage because this cartilage is taking part in forming a joint. So whichever thing is present in a joint, it would be referred to as articular. Okay, so this is articular cartilage. This is the proximal phalanx, or this one, this bone, and this is the middle phalanx, and then the distal phalanx. So this is present between the proximal and the middle phalanx, and these are the structures which are present here. Now this concept would be repeated again and again in smaller synovial joints as well as larger synovial joints. There would be an outer fibrous capsule, then there will be a synovial membrane, synovial cavity which contains synovial fluid, and articular cartilages which should cover both of the bones that are involved in the joint forming. Moreover, there are some ligaments that are present on the outer surface near the capsule, next to the capsule actually. These ligaments are passing outside the capsule and they would allow the movement of that joint. to and fro movement or any kind of movement. Now, if we look at the bone, the outer covering of the bone is known as the periosteum, and then there is the bony tissue. Okay. So these were the structures that were explained in this pictogram. So by now you must understand the basic concept behind a synovial joint and basic structures which are involved in forming a synovial joint. So now let's proceed further. Let's look at the characters of the synovial joint. So a synovial joint contains an a synovial capsule or articular capsule. Articular, as I've explained to you earlier, is related to a joint. So the joint capsule or synovial capsule would contain the joint cavity. Joint cavity we've seen earlier, which is made up of a fibrous capsule lined by synovial membrane. So the fibrous capsule, synovial membrane, joint, and then synovial cavity. The fibrous capsule is sensitive to the stretching movement. So the fibrous capsule would sense the stretch, the flexion or the relaxation of that particular joint, and it would allow a range of movement. Beyond that range it would not allow the joint to go, but if that joint is bent beyond the range, this fibrous capsule would be damaged. Then there is the synovial fluid. Synovial fluid is present in the synovial cavity. It is a slippery fluid that would feed the cartilages. So it would keep in contact with the cartilages and keep them wet. Moreover, there is the articular cartilage. Articular cartilage is present on the ends of both bones. It is in fact hyaline cartilage which would cover the joint surfaces. Sometimes the joint cavity have articular discs and menisci inside it, such as in sternoclavicular joint and knee joint. Now, when we will look at the knee joint and the sternoclavicular joint in the next slide, I'll show you there are small discs made up of cartilage that are present there that provide support to that particular part. Moreover, they would absorb shock. If a person falls, if gets hit, they would absorb that shock. They would not let it disrupt the joint cavity. They would not let it disrupt the synovial membrane. Moreover, they help in guiding the bony movements and would distribute forces. So this is the main reason why the discs are present or the meniscus is present. I'll show you some of these when we go forward. There is the medial meniscus and lateral meniscus that is present in the foot, जिसे वो चपनी कहते हैं हम, ठीक है, that is present there. So I'll show you in the next slide. Moreover, there are tendons and ligaments that would surround the joint and make it stable. As seen here, these tendons and ligaments would surround the joint. They would help in movement and moreover make the joint stable. They would keep it in place. They would not let this bone go this way or this way. They would keep it here in front of the other bone, and even when it's bending, they would not let it slip past the bone, past the other bone. So this is why the tendon ligaments are present here. Now let's talk about tendon sheaths and bursa. Now, bursa are actually sac-like extensions of the joint capsule. So this is the main this is a tendon. This is the main joint, but sometimes this joint capsule is extended into a sheet-like sac-like covering that is known as a bursa. Now if we look at this the joint between the radius ulna and the carpals metacarpals. The joint is present here, but its cavity is extending up till here. So why is this present? It is present between the nearby structures, so that the structures would slide more easily past each other. Because in the wrist there are multiple types of movements. The radius and ulna, they show rotating movements, as well as there is extension, there is flexion, there is medial rotation, lateral rotation. There are multiple movements. So to allow the structures to move past each other, if we look at this joint, in this joint only two types of movements would be possible: flexion and relaxation. This would go down, or this would go down. Only these type of movements. But if we have a sac like structure which covers multiple bones, the multiple bones would be able to move against each other and slip past each other while doing the motions. Moreover, there are sometimes tendon sheaths, which are cylinders of connective tissue lined with synovial membrane and wrapped around a tendon. So structure, if this synovial capsule extends to tendons, tendons are basically small extensions of the muscles. If they extend upon them, then it is known as tendon sheath. Now this is a tendon sheath. Let me show you. So what can we see in this pictogram? Let's look at it. So these are normal tendons of the muscle, flexor carpi radialis, tendons of flexor digitorum. Here is the uh, joint that is present between the metacarpals, carpals, and this uh, radius ulna. Now this joint is extending its sac-like cavity upon these structures, so that these structures, these ligaments, while moving, they can slip past each other. They do not rub against each other. That is why the bursas are present. This is a larger muscle that is known as flexor retinaculum. Very important in the flexion of the wrist joint. Then these are small muscles of the fingers, which are known as lumbricals. And you can see from here the tendons of flexor digitorum superficialis, which would attach here in the middle phalanx. They are arising. Now these tendons are covered via sheaths of synovial membrane. These sheaths are known as tendon sheaths. These sheaths would allow free movement of the tendons to and fro motion. And now if you think about it, we keep on using our fingers throughout our life, but they do not get tired so easily. Why is it so? आप कोई भी चीज़ ले लें, if you look at any moving part of a machine, engine ले लें, गाड़ी का कुछ भी ले लें, you do not put the oil in, you do not put a lubricant, engine oil or anything, and you keep using that. What would happen after some time? It would break down because of friction with each other. So why these tendons, these muscles, they keep on going for 60, 50, 60, 70, 100 plus years? It is because Allah Ta'ala has made some special structures which would lubricate them, which would not let them break down so easily. One of these structures is the tendon sheath. So these tendon sheaths would lubricate these tendons, and because we use it too rigorously, there would not be friction, there would be free movement, and that would help in extending the life of those tendons, the viability of those tendons. Now let's look at some types of the synovial joints. So if we go into detail, we can look at some types of the synovial joints. So what can we see here? The first is the ball and the socket joint. Ball and the socket joint is a joint that would provide maximum type of movements. Okay, so it is present in the shoulders. The head of the humerus forms ball and socket joint. Moreover, the femur that is present in the leg would also form ball and socket joint. What happens here is there is a long bone whose upper end is formed like a ball, the head of the humerus or the head of the uh, that femur. It is transformed into a structure like a ball and it fits into a socket that is present on the upper bone that is connecting with it, such as the case of scapula in the case of or shoulder, and the hip bone in case of the leg. This ball and socket joint would allow maximum types of movement. We'll study about those in the next slides in detail. Now we just need to look at the structure. Then there are pivotal joints. Pivot joints are those which would allow rotatory motion. Now here you can see in ball and socket joint, rotation of the lower bone can take place. Moreover, rotation of the ball and socket can take place. Moreover, extension, flexion, adduction, abduction, all of these movements can take place. If we look at the pivot joints such as between the radius and the ulna, it would provide unilateral rotation, rotatory movement. Then there are hinge joints. Hinge joints would act like a hinge. They would provide flexion and relaxatory movements. So you can see this joint is like a hinge, and the distal bone would move up and down on that hinge. It would provide unidirectional movement. Then comes the gliding joint. Gliding joint, as clear by its name, one bone is gliding upon the other bone, and the distal bone can move in any direction, up, down, right, left, any direction. Then there is the saddle joint. Saddle joint is uh, when saddle, पता है किसे कहते हैं? Saddle body like structure, saddle that we place on a horse. So its shape is like that. The lower bone can show up and down movement, or right to left movement only. Then there is condyloid joint. Condyloid joint is present in the metacarpal bones between the phalanxes. They would also provide movement in two directions, right and left. So these are the joints. These were the types of synovial joints. Ball and socket joint. You need to remember this, present in the head of the humerus, between the head of the humerus and the scapula, and the hip bone and the femur. Then there is the pivot joint that is present between the radius and the ulna, as well as the tibiofibula. Saddle joint that is present between the at the carpo-metacarpal junction. Then there is the condyloid joint that is present between two metacarpal bones, and gliding joint that is present between the carpals. Same is for the foot. Here would be the tarsal joint. Here would be the uh, tibiofibula joint. Here would be the tarso-metatarsal joint, metatarsal joint. These are examples. Okay, so now let's look at ball and socket joint. So ball and socket joint, as clear by its name, the long bone, its upper end or head, would form a ball-like structure that would fit into a socket-like structure. It is a smooth hemispherical. It is where smooth hemispherical head would fit within a cup-like depression. So here you can see this is the head of humerus fitting into the scapula. Head of the humerus would fit into the glenoid cavity of the scapula. This is the glenoid cavity, and head of femur would fit into the acetabulum that is present in the hip bone. It is a multi-axial joint. Multi-axial means it will provide a range of movements. This bone can move up or down, right, back or forward, and then as well as rotatory motion is allowed to some degree. So it is multi-axial joint. Multiple type of movements are allowed. Then comes the condylar, which is also known as bicondylar or ellipsoid joint. It is a oval. It is where an oval convex surface on one bone would fit into a similarly shaped concave surface or depression on the next bone. As in knee joint, radiocarpal joint of the wrist, metacarpophalangeal joints at the bases of fingers, and it would allow biaxial. It is a biaxial movement that is, it would allow two types of movements. That is in the transverse axis, the bending movement, the flexion and relaxation kind of movement, and all would also allow partly allow rotation. So you can see this convex surface is binding on a concave surface here. Same would be present in the here. This convex surface of the metacarpophalangeal joint, this convex surface is fitting on a concave surface. This is an example of condyloid or condylar joint. So remember, ball and socket, multi-axial movement, condylar, biaxial, transverse movement and some degree of rotation. Then comes the saddle joint. In saddle joint, each articular surface is shaped like a saddle, concave in one direction and convex in the other direction. The joint between the trapezoid and the metacarpals, trapezoid bone is one of the carpals, at the base of the thumb, which is the first metacarpal joint, is an example of the saddle joint. It is also a biaxial joint that is more movable than a condyloid or hinge joint. So let's look at an example of the saddle joint. So this is trapezio metacarpal joint that is present between the thumb and the first metacarpal. So what can we see here? This surface is concave on one end, convex on the other. Same as the case of this structure, concave on one end and convex on the other. And the concave surfaces of the both bones would fit together. It would allow two types of movements, transverse movements as well as rotatory movements, but the movements in this joint are more than this joint. The rotation is more in this joint as compared to this one. Okay, the next is the gliding joint. Let me check just a second. Yeah. Okay, so let's finish the joints. The gliding or plane joints are where a flat surface, a plane surface of a bone would make joint with the flat surface of another bone. So flat plane articular surfaces in which bones would slide or glide over each other. These are considered amphiarthrosis. The examples are intercarpal joints between the carpals, intertarsal joints which are present between the tarsals, joints between articular processes of vertebra. So they would allow movement to very little degree. They would not allow so much movement. Then come the hinge joints. Hinge joints are one of the strongest joints in the body. Articular surfaces are pulley shaped. So have you seen a pulley? In a pulley, when we need to lift something up, we would use a hinge. So they just look like those. These joints, you need to remember the examples of types of joints. Okay, which joint is present where? Which type of joint is present where? For example, if I ask you, joint between the femur and the scapulum of the hip bone is, you must know what type of joint is it. Is it a pivot joint, hinge joint, ball and socket joint? What type of joint it is? So articular surfaces are pulley shaped. This is present at the elbow between ulna and humerus. The ankle joint is an example between the carpals and the radial, and the ankle joint is between the tibia fibula and the tarsals, and the finger and toe joints, interphalangeal joints, are an example. They only allow monoaxial movement, that is one direction of movement, that is only on a transverse axis, a flexion and relaxation kind of movement. And there are strong collateral ligaments on either side of these joints. These are one of the strongest joints in the body. There are strong ligaments on both sides of these joints, because these are actually the weight bearing joints of the body. That's why we need to keep them intact in their position. The bones need to be only able to move in one direction, and we cannot have any laxing kind of movement in this joint. Now at last is the pivot joint. In pivot joint, one bone has a projection that would fit into a ring-like ligament of the other bone, and one bone would rotate on its longitudinal axis relative to the other bone. This type of joint is between the radius and the ulna, where one bone is stationary and the other bone is slightly rotating, and the first and the second vertebra, that is atlantoaxial joint, between the axis and the atlas. This joint is also present on superior and inferior radio-ulnar surface, which allows the radius to move during pronation and supination, that is movements of forearm. About the movements, we'll see these in the next lecture, inshallah. I'll show you these movements along with some video presentations, so you would be able to understand them more. So this is the pivot joint. Let me show you in some detail here. So this is the pivot joint. All right, the radius is able to move. The ulna has a concave surface. Radius is just like a kind of fits into its socket, and it is able to rotate on the ulna. This is a pivot joint. So which I hope all of you are getting the point, understanding these basic things, because they would help you a lot during your uh, second years, third years, and surgery, up till surgery, and even after completing the degree. So this is actually more of kind of a practical education. So you need to remember these things, study these things, and memorize these. Okay, thank you, take care, Allah Hafiz.